Hello everyone, I'm urologist Omar Makaya. The subject I will talk about today will be about a mistake I see very often. I made this video for friends who use anabolic steroids. Because people search on their own, and they find Rimabolon. He reads that Rimabolon is the least harmful steroid. Arnold Schwarzenegger uses it. He says, "I'm gonna use this, I'm gonna build my body even more." Friends, erectile dysfunction or suppression of LH-FSH, pituitary suppression may occur after the use of Rimabolon. They ask a lot about the need for PCT after Rimabolon. We actually made a video about this. No matter which anabolic steroid you use, have your LH-FSH values checked after you stop using it. If it has not improved, you need to use PCT. I will talk specifically about this issue, friends. When Rimabolon is used alone, your testosterone level starts to decrease. Rimabolon because it is a dihydrotestosterone analog product. When you use it, your natural testosterone drops. There is a large amount of dihydrotestosterone derivative substance in the body. Since your own endogenous testosterone drops, erectile dysfunction and loss of sex drive may occur naturally. These may occur in the cure, friends. In other cures, for example, since testosterone is used together with Rimabolon, we do not expect any erectile dysfunction or any problems in the cure. But when Rimabolon is used alone, erectile dysfunction and loss of sex drive can develop even within the cure. Not necessarily everyone will develop erectile dysfunction or other problems. But we should not act with things like Arnold Schwarzenegger was using that we hear on the internet. Arnold Schwarzenegger probably isn't just on Rimabolon. He's on a lot of drugs. Maybe this is one of his favorites, guys. So don't believe everything you read. Internet, Google is actually like a garbage dump most of the time. In other words, it is very difficult to find the right information from there, to distinguish it, to use it. It also happens to us. For example, you see a lot of surgery techniques on YouTube. A doctor does surgery and so on. But of course, we do not know what the patient has become after the operation. We do not know what it has become in the follow-up process. But we also learn a lot of things from there, friends. But it is very difficult to get the right information and evaluate it. So I will say this lastly. Rimabolon alone is not used for bodybuilding. It would be very good to talk to athlete friends about this issue. It would be great to talk to someone who knows the job. It's definitely not me, mates. They ask me for advice or counseling on the use of anabolic steroids or cure. I have absolutely no experience in this subject. Do not get counseling from me in this way. But you can consult me for the PCT period or for negative distressing events that happen to you after anabolic steroid use. But as I said, about the cure, about muscle development, frankly friends, I have neither knowledge nor experience. So I don't comment on these issues anyway, but this is for sure. Many patients applied to me because of erectile dysfunction during the cure because they only used Rimabolon. The reason for this is that after the use of Rimabolon in the cure, the endogenous testosterone level, that is, the testosterone level you produce yourself, decreases considerably and therefore the erectile dysfunction develops in the person. Thank you for listening.